In this video, I'm going to describe to you what degenerative disc disease means. It has very common names also associated with it: stenosis, arthritis, um, and we're going to talk about that right now. My name is Dr. Andrew Gorecki. I am a physical therapist. I'm a back pain specialist, and I'm going to use my screen here to try to help you understand what degenerative disc disease means. All right, so if we zoom in here to the spine, you can see that our bones, we have these things called vertebrae, right? We have vertebrae at each level. In between those vertebrae, we have what's called a disc. And I'm going to show you what that looks like real quick. If I take away that big ligament in the front, you can see there's a disc right here, right? Now, degenerative disc disease is something that happens as we age. And what it means is that this disc space, how wide this is, as time goes on, becomes narrow. It becomes shorter. It starts to shrink. This is why we lose height as we get older. Most people can relate to the fact that we've lost height as we age. The main reason is because the discs between each level of our spine have gotten shorter. They are degenerating. Really what it means is they're getting dehydrated. They are losing fluid. They're becoming more, when you're young, those discs are like crab meat material. And when you get older, let's say in your 80s, it turns into leather, like a leather belt feeling. And so as we age, that is what's happening. That's actually natural and normal, and it happens to every single one of us. We cannot avoid that, right? And so that's just a fact. We have plenty of research to provide that information. Now, why does it cause pain? Well, as we can see here, I'm going to try to zoom in a little bit on these lower segments of the lower spine. Something to really pay attention to or highlight is that there's a little hole right here, right? You can see this hole. I'm going to get rid of this so we can see more of this stuff and just kind of focus on what we want to focus on here. As I kind of spin around here, you can see there's a hole. Now, why is that hole important? Well, that hole, the diameter of that hole is where each one of our nerves come out of the spine. So we have what's called a nerve root. And if we're talking about our lower back, that nerve root travels all the way down to the legs, all the way down to the toes, right? And that can cause, if that thing is compressed or squeezed, that can cause pain, severe pain, radiating pain, numbness, tingling, and even weakness in the legs, if we're talking about the legs. The same thing can happen up in the neck as well, down our arms. Now, and you can get degenerative disc disease at any level of the spine, and actually every level of the spine happens to all of us as we age. Now, as this disc space narrows, it also makes the diameter of this hole smaller, right? And so if I add some nerves in here, you can see that there's a nerve that comes out of that hole, right? See if we can get a better view. That is a nerve root. It comes out of the spinal cord through that little hole. Now, if I make that hole diameter smaller, it makes it more likely that that nerve is going to get compressed. When that nerve gets compressed, it causes symptoms, pain typically, and numbness and tingling. Not a good situation, right? Now, the cool thing though is that this hole is not a fixed hole, meaning it's actually the top of the hole. The top of the hole is, let's see if I can get rid of that, is the top of the hole and the bottom of the hole are both, the half circles of the hole are both created by the bony vertebrae from the top and the bottom. And these things move, right? So this is where the movement occurs in your spine. So that means that certain movements like bending forward are going to open up the hole, which the nerve likes. That's oftentimes why you see people that have degenerative disc disease. They feel better when they bend forward. Now, when I bend backwards, it makes the hole close down, right? And so the cool thing about this is that it is absolutely treatable. Pain can be relieved as long as we focus on opening up the hole more and reducing the motions that cause the hole to close down. But hopefully that gives you a quick Oh, by the way, that's also why another name for degenerative disc disease is called stenosis. Stenosis is the Latin term for narrowing. That means this hole is becoming more narrow as we age. Hopefully that helps you understand more about what degenerative disc disease really means.